What's going on, everyone? This is Greg with sportsrehabexpert.com. Today we're going to be answering an important question as it relates to should you get an image, whether that's an MRI or an X-ray, as it relates to knee pain. Now, we could extrapolate this for other areas in the body too and take these findings that I'm going to relate to you that are recently been reported in a pretty significant study. We could take this and put it for any type of body part for that matter. The concept still applies to a lot of those injuries as well too, but this study is going to be talking about knee pain. And we'll put the name of the study up here just so you can look at it too if you're interested in it. But what they essentially did is they looked at 230 asymptomatic, meaning no pain, knees through an MRI. Again, these are individuals with no pain, but what they found was that from an MRI, there was 62% of those 230's non-painful knees, 62% of them had cartilage lesions. Of those 62% cartilage lesions, they found that 41% of them were type 4, or the most severe quote-unquote cartilage lesion that you could find. Again, these are individuals with no pain. 48% of these asymptomatic, non-painful knees had meniscal lesions. So right there is kind of proof in the pudding in and of itself. If you have a meniscus injury, you don't necessarily need to have surgery or an MRI right away. A lot of times these things go away on their own, and just because you have a diagnostic finding on MRI does not mean that this is going to be problematic for you long term, so long as you address the issue in the right manner. But that's not all. We're going to go to 46% of these asymptomatic non-painful knees had tendon issues. 27% of that grouping was patellar tendon. And then when we consider ligament issues, 38% had ligament issues. Again, non-painful knees. Of those 38%, 34% of those were ACL injuries that were found on MRI of non-symptomatic or non-painful knees. Some other common scary diagnoses that doctors will throw out at you. 33% had Baker's cysts, 26% had patellar bursitis, and 23% had fat pad inflammation. So the purpose of me bringing up this study is just to relate to you that those who are in pain often have very similar findings to those who are in pain on an MRI or an X-ray or any type of image for that matter. So is a image that many people feel is the gold standard, and many people feel doom and gloom after getting an image and a diagnosis that they feel this is the root of their problem, when actuality many people who have no symptoms in their knees have the exact same finding on the image. So is an image really actually necessary, and is it a gold standard? In my opinion, this study, there's many other studies out there that are just like this, and again, for multiple areas in the body, not just the knee, but it shows how getting an image right away when you're experiencing pain is not often necessary or needed, and in actuality causes more problems than good, because it makes you feel beaten. It makes you feel defeated, because now you have this diagnosis that quote unquote you are going to live with for the rest of your life. But again, in actuality, individuals who have no pain at all have similar findings on an MRI or an X-ray. So this just means that we need to not put so much stock into an image right away. It means we need to try other measures that involve movement, strength training in a pain-free manner that helps you overcome an issue. And as long as you're doing it in the correct manner, many times these issues just go away on their own. We need to stop with all the doom and gloom. We need to stop with all the internalizing of a diagnosis, because oftentimes you are not the equivalent of your diagnosis. Find what you can currently do. Keep control of the issue yourself by managing the problem, managing your current levels of pain, and find ways to continually promote progress. That is easier said than it is done, but that's why there's rehab professionals out there. Find a trusted one that you believe will help guide you in the right manner and not lead you astray down some long road of recovery that chasing surgeries, medication, and other useless forms of therapies that are more placebo driven than anything.